Okay, so what if I told you the biggest threat to your health wasn't like some new virus we haven't heard of yet? Or, some hacker trying to get your data, but maybe it's someone you actually trust, like your own doctor. And I don't mean some back alley quack. I mean the person in the white coat, writing prescriptions, billing insurance, the one you see in the clinic.
It's a really chilling thought, isn't it? Because
Yeah.
that trust, well, it can be exploited
Yeah.
profoundly. And we're talking licensed professionals here,
Yeah.
doctors, nurses. The sheer scale of the deception, that's what's really kind of mind-blowing about this.
Exactly. And that's what we're going to unpack today. This deep dive is all about the largest healthcare fraud bust in U.S. history. Seriously. We're looking at 324 people exposed. Criminals, basically, who happened to wear lab coats. They were manipulating Medicare. They were exploiting really vulnerable patients and just feeding off the sick. All for profit. And the price tag on all this, get this, $2.9 billion.
Wow. 2.9 billion. That immediately makes you ask, right, is this just a few bad apples?
Yeah.
Or is something bigger going on, something systemic?
Well, the sources we looked at, they're pretty clear this is not a bad apple situation. It's more like, well, they described it as a rotting orchard.
Yeah.
So our mission today is to take you inside this takedown. The Department of Justice, the DOJ, they just dropped this like a sledgehammer. We need to see how deep this rot actually goes.
And what's really striking is just the scope, the coordination. The authorities themselves call this whole thing unprecedented.
Mm.
You've got the DOJ's healthcare fraud unit leading the charge, but working really closely with the FBI, HHS OIG, that's the Health and Human Services Inspector General,
Right.
and even state attorneys general, all across 36 federal districts. That kind of cooperation, it tells you something about how widespread this was.
Yeah, 36 districts. And it wasn't just doctors, which, is maybe the first thing you think of. It was, well, a whole cast of characters, really, all in on it.
Right.
Yes, you had licensed physicians, registered nurses, sure, but also telemedicine executives, owners of durable medical equipment companies,
Yeah.
pharmacy operators, even heads of addiction treatment centers.
It touches so many parts of the system
It really does. Shows how it wasn't just one weak spot.
and the ways they did it.
Yeah.
Some of the schemes were almost brazenly simple, but incredibly effective. You had pharmacy owners, for example, just pocketing millions, billing for prescriptions they never even filled,
Phantom prescription.
pretty much.
Yeah.
Or another group billing Medicare for home health services that never happened. Sometimes the patients didn't even exist. These weren't just like complex financial schemes. It was straight up theft from programs meant to help people.
And this next part. Honestly, this was really disturbing. In some places, they had recruiters who were paid kickbacks, their job, to sign up homeless people for fake treatments. Yeah, just so the providers could bill the government. Think about that. It's like human trafficking mixed with white-collar crime.
Horrifying. It shows a complete lack of empathy, just pure exploitation.
Absolutely.
The length they'd go to.
And that pattern, exploiting vulnerability, it leads us straight into how they weaponized a national tragedy. The opioid epidemic. We all know how devastating that's been, right? But this investigation shows how it was actively twisted, manipulated for huge profits.
Yeah, more than 100 of the defendants, over 100, were charged specifically with diverting prescription drugs. And we're not talking about small stuff. It's oxycodone, hydrocodone, Adderall, even drugs like Suboxone, which are meant to treat addiction.
Exactly. The mechanism was often quite simple, devastatingly so. Doctors, pharmacies, they'd prescribe these really powerful meds to people who obviously didn't need them. Then they'd bill Medicare or Medicaid, like it was legitimate. But the drugs, they just ended up on the street, sold for cash,
So they're literally fueling the crisis.
directly fueling it and profiting from it. There was one case, just an extreme example, a clinic that operated, the sources said, more like a drug cartel than a treatment center.
A drug cartel, seriously?
Yeah, giving opioids to known dealers,
Yeah.
and then just charging insurance companies for fake office visits. So instead of helping people get clean, they were making money keeping them hooked. The cynicism is just, it's hard to fathom,
It really is. And then, of course, then came COVID.
right? And like any big crisis, it just created new opportunities for fraudsters, especially with telemedicine. Everyone was vulnerable, the system was stressed, and these scammers just saw a new payday.
Yeah, it was the perfect storm, wasn't it? In-person visits were down, telehealth was exploding, so these fraudsters jumped in, posing as telehealth providers. They'd offer these consults. Sometimes they literally lasted 30 seconds, or just didn't happen at all. It was just a smokescreen.
A digital handshake, basically, to unlock the billing codes. And those fake consults, They were the excuse to prescribe durable medical equipment. DME,
Hmm.
things like braces, orthotics, even pricey genetic tests.
Okay.
Then they just bill Medicare and Medicaid millions, all based on these sham consultations. Just a massive paper trail of completely fake care.
And the scale, I mean, get this example. One ring operating across 5 states. 5. They used stolen patient data and submitted over $150 million in false claims for DME. The reports literally said, no treatment, no patient interaction, just bots, billing codes, and bank deposits.
Wow. Bots and billing codes.
Yeah, just think about that. Middle of a global pandemic, people are desperate for real care, and these guys are just automating theft on a massive scale, using stolen identities.
It's incredibly cynical, just pure opportunism during a crisis.
So you've got this river of stolen money, right? $2.9 billion overall. The obvious question is, where did it go?
Well, it's fascinating because they weren't exactly trying to hide the wealth, were they?
Hidden. Not a chance. This money went straight into, luxury cars, huge mansions, wire transfers zipping off to overseas accounts. It was a lifestyle literally built on lies. There was a doctor in Miami, billed $20 million in fake services. $20 million. Used the cash to fund a lifestyle the sources called worthy of a rap video.
Unbelievable. Or the telemedicine CEO took stolen government money, bought beachfront properties, plowed funds into crypto, and these weren't like sloppy small-time operations. The sources stress this. They were sophisticated,
Right.
using shell companies, fake clinics, spread across states like Texas, Florida, New York, California. It wasn't just individuals acting alone. It was, as one source put it, like a corporate criminal enterprise disguised as healthcare.
Wow, a corporate criminal enterprise. But, this time the system did fight back, and it seems like it hit hard.
It really did. The hammer definitely fell this time. And the results are pretty stark when you lay them out. You've got the 324 people charged, that massive $2.9 billion in fraud exposed, plus over 100 professional licenses revoked or suspended. And dozens of assets seized. We're talking luxury homes, sports cars, even crypto wallets were frozen and seized.
And the DOJ, they weren't exactly subtle about why they did this massive sweep, right?
Not at all. They explicitly called this operation a message. The warning was loud and clear. If you're exploiting patients, if you're billing for services never rendered, for ghosts.
Yeah.
If you're handing out pills for profit.
Expect that knock at the door.
Expect the knock at the door. That was the message.
So we started this whole deep dive with that question, didn't we, about trust and who the real threat might be?
And I think we land on a pretty powerful, if unsettling, answer. One source put it perfectly, I thought, what's scarier than organized crime?
Right.
Organized crime with a stethoscope.
Oof, that hits hard. Because this story, it isn't just about, broken systems or loopholes. It feels like it's about people, individuals who knew exactly what they were doing and just didn't care. Didn't care about the patients, the cost, the damage.
It really highlights that terrible intersection, doesn't it? Where rules meant to help people, rules for access to care, rules for managing a crisis like COVID get twisted. They become a blueprint for fraud when the oversight just isn't there or it gets completely overwhelmed.
Which kind of leaves us, and maybe you, the listener, with a final, maybe uncomfortable question to think about. So next time you walk into a clinic or log on to a telehealth call, just ask yourself, are they really here to heal? Or maybe to hustle?